Welcome to New London Views. I'm your host, Bryan Doughty. I haven't done this in a long time. I think it's almost been a year. But I'm back, and I guess I would say stronger than ever because I have 3 people joining me versus just the one. So I'm quite excited about this. I have Trish Rios from New London County Cares, Margaret Lancaster from Legislate, who also partners with New London County Cares, and a lot of people who watch might know Ruben, who last time I think was here didn't have a job, but you have one now.
Yeah.
And I'm super excited about that. But I'm going to start with them for New London County Cares. And I guess the first thing is, could you tell me what New London County Cares is?
Yeah, New London County Cares is New London, NLC Cares is a New London coordinated access resource, engagement and support system. So it's a collaboration between Alliance for Living, Legislate Health District, and the City of New London. And what it does is to reduce the discrimination and barriers faced by people who use drugs. And this initiative is for the Overdose Action Team, which is Southeastern Connecticut's task force, okay? We merged together with the community and other agencies, government agencies and local agencies that serve individuals with substance use disorder and opioid use disorder. And we have this one OAT meeting that meets once a month. And what we do is we try to eliminate and help the barriers that have been set up for individuals, or semi-systemly set up sometimes for individuals who have opioid use disorder and substance use disorder. In 2017, it began as a meeting with community members and organizations and people from the region that were very interested in trying to make things change and take the stigma away from the individuals with substance use disorder and opioid use disorder. And then 2018, NLC Cares came out of the whole project, and it launched to increase the low barrier access for information for people with substance use disorder. And it supports the evidence-based treatment, which continues on today. And today, the newest vision is to expand and build on the new system that will increase the sense of well-being and safety and connectedness and belonging for community members who have continually oppressed and not cared for by the existing systems that have taken place in our community. Wow, it's a lot.
Sounds like you have a broad-ranging scope of things you're doing.
Yeah.
So I guess maybe you could describe from what you had said, and anybody can jump in, what are those barriers? Like, what are we trying to break down so that people do have access to care or the stigma is removed?
The stigma is what we're trying to break, as far as even from going to the doctors. When we first started this in 2017, a person couldn't get a doctor's appointment to get medication-based treatment. It would take them 2 to 3 weeks to get an appointment. Now when somebody is ready to make a change and you tell them, oh, I can get you in 2 to 3 weeks, we lost a lot of connections because you have a very small window of time to get somebody connected. So, and that's one of the biggest accomplishments I think we've been able to come up with is instant access. Within, I want to say the same day, within 24 hours, we can get somebody whatever they want to do. Get them seen, get them to a primary care, get them situated.
So you said you started in 2017, and obviously we've had COVID in between then and today. Mm-hmm. So how did that affect the appointments? Are we still able to plunk along and
We didn't stop.
Good, and you're still able to get appointments within a short time period?
Absolutely.
That's outstanding for anybody who needs it, I would think, physically, mentally, or whatever. Making the decision in whatever your issue might be to get help is a giant hurdle.
Yeah.
And if, like you said, if you're told, sorry, 2 weeks, I don't think it's going to work.
Yeah.
Then you're going to have to reapproach that hurdle. So I know I talked to Ruben, or he had put some things on Facebook about like places where people can get NARCAN spray or different things in the community. And I know in New London, one is at Fiddleheads, and you had mentioned 2 firehouses in Waterford. So I wonder if you can just kind of take me through what those are. Maybe this one's for you, Ruben, and what people will see there so they can get some help.
Well, they're Naloxone boxes, and there was actually overdose at Fiddleheads in the front. It was somebody that overdosed. Okay. So we went there. They didn't know what to do, you know, and we did a training there, and you know, and they were so just grateful for it. Like, it was tears, you know. Everybody had and everybody had a story to go along with it. You know what I'm saying? So it was So, you know, a lot of people doesn't have access to it. So this way, if there's boxes all around the town, people know where they can go get it. And, you know, because you gotta have a prescription for it. That's another stigma with it. You know, you gotta be prescribed to get naloxone. So, you know, we have access to it, and we can also give it away, you know, for people that need it.
So for training, I know as a Board of Ed member, we had training at our school district. I think you had said you did the training?
I did the training, yeah.
So maybe you can take me through what is the training, how long does it take? Is it something that's easy to do?
Absolutely. It's you can learn in about 15 to 20 minutes how to administer it.
I like those short ones.
But based on questions, and what we want to make sure everyone is very well equipped to understand what an individual may be going through after they come out of being a reversal from NARCAN. You know, it's also that stigma that goes along with that. What the person might need and may tell you what they may not want at the time. Some people refuse, that they don't want to go in the ambulance, and that's okay, you know. But we want to always make sure that they're left with some information to get in contact with a peers navigator or to an NLC cares line, so they have support and resources they can reach out to if they need be. And now we do have this new program, Leave Behind program, through the EMS systems through our county, and they're all jumping on board slowly but surely, but it's a Leave Behind a NARCAN kit in case someone does decide to refuse transport to the ED. And there's a card in there that says you've experienced an overdose, and all our information is in there, and they can call us and they can just get connected with a peer navigator through Alliance for Living. So
I'm glad you mentioned call. We have overdose items appearing, and call 911. But you said call you. Is that something that's 24/7? Are there certain hours or?
I think Trish can answer that.
Okay. Yeah, I'm not sure where the question is.
Trish will answer that.
So right now I have the on-call phone. So we get back to you right away. If we don't get to you, we return a call very quickly. I want to say within 24 hours to be like politically correct, but it's very quick. If we don't answer it right away, we get right back to you. And those calls look very different. It could be a call asking for NARCAN, because NARCAN is very expensive. Some people don't have insurance. Some people don't have the money to purchase it. Yes. Some people don't know where to purchase it or where to go get a prescription. Or we also provide NARCAN. Some of the calls are people asking for help, not knowing what to do or how to do it. And some of it is family support, like their kid, their loved one is struggling and they need help. We get calls, all types of calls. But yeah, so you just call us, ask any questions you want, and it will get you to where you need to be.
Good. Well, I think it's fantastic. First of all, getting back to anybody in 24 hours is a challenge.
Yeah, but no, we really are. It's very quick response.
And so we had talked briefly before. There's an uptick in overdoses, and I think you had said you believe there's an uptick continuing in January, February into March this year. So I'm wondering if you could take us through what's happening in maybe a couple of our communities, maybe by county, and maybe even nationwide, if you have a perspective on that as well.
Yeah, so nationwide, the last count we had was 148,000 to 150,000 people have overdosed this past year. So I could say up to January, that was the last count we had.
And that's in 1 year, 2022?
Yeah, that's nationwide.
Right.
In our local area, our county, including two of the other districts that fall under our Overdose to Data Action Grant, there's actually been 83 since January 1st up to March 4th. So the higher numbers right now we've seen are in New London and Norwich, and Groton is next to that. And we have to remember that when we say overdoses, some are fatal. I don't have those numbers directly, but this is the overdoses that occurred during that time. And I don't have the numbers based on the amount of naloxone that was provided or naloxone was given. We do get that stats as well, if it was provided on the scene or someone had administered prior to the EMSs getting there. I just don't happen to have those stats with us today.
Sure.
But that's what we're looking at. So in a period of, January, February, March, 3 months.
So one of the I was looking through Department of Public Health info from last year, and one of the things I just noticed that New London County were high compared to the rest of the counties in the state. Again, that seems pretty consistent since 2019, and I'm wondering if there's a reason why New London County might have more overdoses than some of the other counties.
I think it's also done per capita, the number of
Right.
people that are there, and it also stems to remember that we are a more of a place for transient individuals. Like we have most of our systems and resources and services are all located in New London, so a lot of people will come to New London for what they need. Based on we think of the Homeless Hospitality Center, which is only shelter, and we have treatment centers that are just locally that are in Groton and New London. Our detox is in New London. Our methadone clinics are in New London and Norwich. So, I'm not saying it as to stigma, but see where the services are provided. They're
Sure.
basically in our considered continued cities, which aren't really that large, but when it's a need and someone wants to get help, they're going to come to those places.
Right, and so I have a question for you, Ruben.
Yes.
So you've been going out and doing programs at different places. Like you've gone to some schools and different places. I'm wondering if you can tell me places where you have been talking about addiction and opioids and overdoses and different things.
Ooh. As in training or just speaking to?
Just speaking, I see your posts on Facebook a lot.
Yeah, yeah. We doing the work that we do, which is a blessing because we all have an experience when it comes to addiction, drugs, overdoses. We all have a story. So, I'll have people just inbox me, I'm going through something. I want to stop drinking. Who do I go to? I'm homeless. I want to stop using fentanyl. So, these conversations, I could be in a grocery store and an old woman can come to me like, listen, my grandson is, addicted to pills. Can I have your card? I don't know who else, but I see, and a lot of people don't know me, but they know me, and can I have your card? And, either if I can't help, I can go to Trish. If I can't help with anything, I can go to Margaret or Donnie or anybody, it's just like a community connection. So these conversations come everywhere, church. We have participants that are coming out of in incarcerated settings, So we go to the jails, we meet them. What do you need when you get out? What's going to be your biggest fear? A lot of it's transportation, cell phones, food, monetary. Some want to get back in touch with their children. They need rides to their appointments. So the conversations are everywhere. So it's just not like one specific. I got family members that, reach out and I get them where they need to go,
I think that's one of the biggest struggle, not just with drug addiction, but anything.
Yeah.
People don't know where to go to find the answer. So people like Ruben, I don't know if you can solve the problems, but you can find the person who can solve the problems.
That's our job. We're
Resources.
We just bounce off each other. And that's another big thing, another stigma in our community. A lot of people don't know. If we could put up this overdose sign in the store window. Nobody's gonna read it. That's why I do a lot of lives. That's why we went on the radio station, because a lot of people listen to 929 in our community, which is my cousin's radio station. So we have to find a way to get this, to get this information out there that we know that people are gonna listen to. A lot of people, they're not gonna sign. You can hang up a million signs. You can give people cards, they put it in their pocket, throw it away. But if you're like right in their face, that's why I make sure we get as much information as we can out there. Because, even when I started working for Legislate, I was like, wow, I didn't know that, we do that. I didn't know that this is here, and learning from Margaret and Trish, and like, really, we can help them with this? Oh, there's a shelter over here. It's a lot of stuff that I didn't know that I learned that, that I'm getting information out there to people now.
And I would say I don't think coming out of COVID we have a lot of positive things to say, but I think a lot more people know what Legislate is now.
Oh yeah,
Right.
yeah.
Absolutely.
Yeah.
And that's one of the things that came out of the epidemic was the COVID epidemic pandemic is that our community knows more about Legislate and what we offer and the things that we were able to enhance. We have community health workers that are out there now that are also trained in NARCAN, who can train other people. And we have a Spanish population out in our community. We have community health workers that speak Spanish, and they go out to that community specifically and help them with the same needs that anybody else has based on food, clothing, and shelter, but they can also assist with if there's any need for NARCAN or any person that might have a substance use disorder in their family or amongst the population that they're serving, they can come get the resources from us and bring them to them. So it's really, and COVID opened the door to a lot of that opportunity for the outreach work to be seen, because people weren't coming out, but we were going out still.
Right, well, and I think you were forced to.
Yeah, yeah.
It's so one of the other questions I have, what can people do, and I'll give this one to you, Trish, to reduce their chances of an overdose? Obviously, not doing anything would be the best, but what are other things can people do, and maybe what are signs that a family member can look for or observe?
So we try to, we saturate this community with NARCAN first and foremost.
Right.
I feel like everybody should have it in their backpack, in their car, in their house. You just never know. I've done 5 reversals myself, and none of them were planned, right? Like none of them were planned. I walked into a store. I seen somebody in their car. I had somebody get in my car and 20 minutes later have an overdose. So be aware of the signs of overdose, right?
So take me through that. So you have someone in your car, and they have something happen. So what would be some of those signs?
So somebody got in my car, 20 minutes later started to experience. They didn't use in my car. They had to have used prior. Got in my car having a full conversation on our way to the hospital anyway for a different situation. And as we pulled into the hospital, they became unresponsive, right? And it looks like, and it could look different for everybody. The drug supply out here now is tainted. It's not just fentanyl as in opiate, as in like heroin. It's in the cocaine, it's in the pressed pills, it's in the crack cocaine. So it could look different for every overdose, could look different. But you're gonna look for falling asleep, non-responsive, blue fingertips, blue lips, pinned pupils. Am I missing any?
Gurgling and choking.
Gurgling, which people could think is snoring. Sure. Right? Because it really does sound like a snore, but that's the fluid in your lungs. It sounds like you're snoring, but that's the gurgling sounds. And if you can't get anybody to respond, that's when you want to call 911 first and foremost, and then administer NARCAN. So be aware of those things, because if somebody is using in your house and you don't know, we try to encourage people not to use alone. Right, and we have the not use alone number. There's apps out there for people to use, so they don't have to, so they can be safer. They can use safer, and just having NARCAN everywhere. And that's why we just encourage people to carry it, have it. If you know your kid could possibly, your grandkid, your significant other, whoever, having NARCAN on hand and being aware.
So I like the idea of having it in everybody's house, that type of thing. But does NARCAN have a shelf life?
Yeah, of course it does.
So what is the shelf life?
I think it's up to 2 years.
2 years
Oh, so it's not
on the box, but you can still continue to use it. If you have it, you can use it past
Don't throw it away.
Don't throw it away.
Right.
Yeah.
Well, it was actually when the Board of Ed moved to add NARCAN to our school district. One of my questions was, does it have a shelf life? And I hope we reach the shelf life.
Yeah.
That would be the goal.
Yeah.
And so the only time we're ordering it is every 2 years.
Yeah.
Absolutely.
But I want to make sure that if it is in someone's house, you don't want to hurt the
Yeah, it
patient
won't hurt.
because it
Right, and it
has
won't
expired
hurt.
or something.
Yeah, and that it won't hurt. There's nothing yet that shows that. So
Okay.
we tell people to use it, use whatever you have until 911 gets there. Wait the 2 to 3 minutes between each dose, right? There's so much that goes into it because your adrenaline kicks in and you're scared. But literally with the drug supply the way it is now, you really have to follow the 2-minute between doses and just have it on hand. I rather, how they say, have it and not need it than to need it and not have it.
It almost sounds like to me that everybody should probably know how to do the Heimlich maneuver,
Right.
in case someone's choking. And it almost sounds like we should have everybody go through a training, so if you observe something happening, you know how to administer.
Right. And nobody, I think there's a lot of misconceptions that come with the NARCAN and using it. Nobody I've yet to see anybody turn into like the Incredible Hulk and like freak out and, you know, hurt anybody. I've never seen that. I've seen people use the NARCAN, have it reverse an overdose, and they're confused, right? They're scared.
Sure.
They're just coming out of an overdose. But I've heard people say, I don't want to use it because I don't want them to be mad, or I don't want them to be angry, or I don't want them to hurt me. Like, none of that, I've never seen any of that happen. So yes, they are, when they come out, they are going to be confused. They're going to be scared. And that's the point of calling 911 first, is to have the professional people there to support the person when they come out of an overdose.
Okay, and so we've gone over some of the numbers, you know, over the year or whatever. And I'm kind of wondering, within those numbers, are there a lot of repeats type of thing?
We don't get the names of everybody that have overdose. We don't. We just get where we need. The reason we use OD maps is get more information about where they may be happening, how we can better message our information about, like, never use alone, and where they can get NARCAN, where the resources can go, and it also helps with what's in the substance that's being used, because it doesn't necessarily mean someone's using, like Trish had mentioned, fentanyl or a heroin or an opioid. They may be using cocaine, and that could be recreationally too, or they could be getting pressed pills because they no longer can get the prescription for their pain medication, you know. And we have to remember that, you know, the supply is now adulterated and it's contaminated. So, and we have to remember that everybody doesn't get drugs from a doctor, you know, and even if it's prescribed, you know, even if you've been prescribed that. And now what we know is fentanyl is being found in more than just the use of as an opioid, as someone who may have opioid use disorder. It's being found in other substances as well.
Sure, and we see on the news a lot of times where some drugs have been laced with X, Y, or Z, and users aren't aware. Is that a current problem? I'm assuming it doesn't ever go away, but have there been any of those instances recently where there's something that's laced with something else that no one knows about, but you have to get the word out as quickly as you can?
That's it.
The drug supply is tainted, period.
We have fentanyl test strips.
Ah, there you go.
So
Hold it up.
So we have test strips that are for fentanyl. So these are the strips that can be used to test the product that they have or the substance that they have. Someone knows they're getting fentanyl, they're not going to use this, wanting to have fentanyl, that's one thing. But if someone wants to find out if a pill that they've maybe purchased, or maybe they've gotten some cocaine for whether recreational use or any type of use, they can test that using a fentanyl test strip.
Okay. And then if there is, for some reason on the street, well, you said all drugs are contaminated, but something that is laced with X, Y, or Z, is there a way that you guys get the word out to people quickly?
Yeah. We have one of our things, Safe for Use Matters, and it tells exactly on the card that it mentions that all the drugs that may have something may have some type of contaminant. What you think you're using may not be what you're using.
Okay.
That's what it says, yeah. And it says Safe for Use Matters, never use alone. It gives us the number. It says how to get in touch with us, NLC Cares, and go slow. It tells you about going slow when you're using any type of opioid. We put that message out there because it's necessary. Take turns. If someone's using with you, don't hide your NARCAN in the cabinet. Leave it out where everyone can see it, so they know where it is in case something does happen while you're there. Because that's the way safety is put in place, you know.
Right.
So that's what we do, and we continue to train our community. And we businesses. We've been out to businesses. We went to the union, local laborers union the other night. We've gone to every bar downtown in New London and
nursing homes.
We've gone to nursing home, senior centers.
I did the fishermen's. All the fishermen in New England.
Wow.
Yeah. So
Did you get
out
any
on
fish?
boats,
on
out
boats,
training these people how to use NARCAN all the way out in boats in the middle of nowhere. Like it needs to be. Drugs are not just a chaotic use thing. Like there's people in houses with careers, families, and that are using and that aren't aware of the fentanyl testing strips because they don't think they need it, right? We're trying to get it out there for everybody. Like this isn't just for people that are experiencing homelessness or going to jail. Like this needs to be just a normal conversation.
And one of the questions I had, it doesn't seem to have, it's across the board, homeless or extremely wealthy.
Yeah.
It seems like it could affect anyone. And continuing to have the conversation. And I have a question for Ruben. Looking through some numbers from 2019 to 2022, it looks like men overdose 2 to 3 times as much as women. And I don't know if maybe is there a reason why, or is there a thought process behind that? I'm just kind of curious. It's just a number that jumped out at me.
I wonder if that's like the reporting of it, and like it's also kind of similar in the treatment facilities too, right? More men go to treatment than women because women have kids, family, like
there's different reasons.
There's different reasons. So I would be interested in finding out what that's about and where those numbers come from. But that's not anything I'm used to hearing.
And when we know the numbers, and we know based on gender, sometimes we get those from the OCME or from DPH or from our own data. Reasoning why, I don't think there's really any specific reason behind it, but I think sometimes it's, I think they look at women and how women use and maybe how men use. It could be, people use, but it could be the like, again, this could be responsibilities based on a woman. It could be that there's more there that women have to, tend to.
Yeah.
And it's just, maybe it's the sense of just, that's how the numbers have come out this time around.
So we had talked about when there's an incident, you leave a package or something with the person who had overdosed them. But I'm wondering, for family members, do you reach out to the family members after someone has overdosed, or do you offer them support or even extended family, that type of thing?
There's a card that says for your loved one, your loved one has experienced.
Yeah.
And that is also the same number, and you can also call that number and talk to somebody.
Okay. And then within our community, we talked about New London a lot. Are you expanding out to other communities within New London County, and what's the sort of the next town, or you just take them all on at once?
Well, yeah, we're trying. I think that the goal is to get out to all the counties, which is harder, obviously, like if I'm going to Colchester, right? Because there's not a lot of people just outside walking around that I could walk up to and be like, hey, I'm Trish, right? But we are definitely moving outside of other areas. We're leaving flyers. We have a van. We're trying to make the van be around more, so people will be maybe more apt to recognize it and be like, oh, I know that van, they might have something. But I think it's just getting the word out there, and our goal is, overdoses are happening throughout all New London County. So we want to be supportive to not just New London and Norwich and Groton. We want to be supportive to our whole community, yeah.
And then, Ruben, you had said earlier that you need a prescription for NARCAN, but then we also talked about you want this in everybody's house. So if you don't need it, because how do you get it into everybody's house if you need a prescription? And I'm not sure who.
The prescription is based on for the pharmacy itself.
Okay.
Okay. So then, but you need a prescription to get it from a pharmacy.
Right.
Okay. And the pharmacist at one of our local ones can actually write. If you ask one, they'll get it for you. You can get a NARCAN kit. Your doctor could write one for you, especially if he's actually writing your script for pain medication or any type of pain management.
Well, hypothetically, what if you don't have a doctor?
Then you could walk into the pharmacy.
Okay.
Yeah, one of the pharmacy. Or you can call Legislative Health District.
Or call us.
Yeah, because Legislative Health District, we have the Overdose to Data Action Grant that is through Department of Public Health.
Okay.
And one of our main goals is to make sure our county is saturated with NARCAN. We gave over 500 NARCAN kits away last year.
Wow. Do you do drives like we had given away lots and lots of COVID tests? Is there a drive that you do where people can come up on a certain day to get NARCAN?
No, we usually get phone calls.
Yeah, we usually get phone calls.
Okay, so it's one-on-one basis.
Yeah, because it is expensive. It's very expensive, and but you know, we don't say no. But we definitely wouldn't be able to fund a drive. That's just a lot. That's just a lot of money that. But we definitely, if you call us, and some people aren't ready to go to the pharmacy. Some people there's stigma attached to that.
And I agree.
Right? So
if I walk into the pharmacy and say I'd like a box of NARCAN,
yeah,
sorry,
right.
That I guess that for some that could be embarrassing. But I don't know if there's that much difference between getting some other things at the pharmacy that aren't that exciting.
Yeah, right.
Yeah, so I think removing the stigma just for drug abuse in general. I mean, we all go through things in life, whatever it may be, but we need to work together and understand and not stigmatize. I mean, you'd been on my show, and you know, coming out of prison and different things, there's a stigma there as well.
Yes.
And so that's why I so much appreciate that you're working with legislators,
Yes.
and you can do things. And you had talked earlier about, you know, people coming back out of prison, and so I'm wondering if someone had gone to prison for whatever reason, they come out, and what are the likelihood they're going to be affected by drugs if that was why they're in there originally?
Well, we have a saying, we don't leave people where we meet them. Just coming home from prison, you basically have no hope because you already know you're going to be stigmatized. You're going to be, oh, you know, you just got out of jail. You know, you're worrying about getting jobs. So, you know, let's say you have an addiction and, you know, so you're already looked at like there's no hope for you, you know. So being a navigator, you know, we stay in touch with these people. We have relationships with them, you know, even after they're done with the study, you know, they still reach out to us. You know, they still give us their testimonies like, hey, man, you know, thank you so much for everything you've done for me. You know, my life's changed around. I got my kids back. I got a good job. I got a car. I got an apartment. So, you know, just staying in these people's life and uplifting them, you know, because sometimes, you know, even in our community, a lot of people have vices that they can't come to people and talk about. And then, you know, when we get the data, you know, they got a fatal here. Then sometimes it's people we know. Like, oh man, you know, I wish you would have reached out to me. But a lot of people are afraid, you know, hey Brian, man, I got a coke problem. What, Ruben? You? Like, what's wrong with you? You know, instead of saying, Ruben, how can I help you? All right, listen, who can I call let's make some calls and get you help. You know, a lot of it's laughed at. You know, a lot of it's frowned upon. You know, you can't go to certain family members. You know, they'll start telling the other family, oh yeah, you know this. Trish is using coke. Like, what's wrong with her? You know what I mean? So in our community, we're trusted. And that's what I love about my job. Because that's very hard for you to trust somebody with your vice. You know, Margaret, I don't know who else to talk to. I'm addicted to fentanyl. I don't want to die. Right. And that moment, they're putting their life in your hands, and for us to help them. So, you know, it's just so great to be placed in this situation, and especially as navigators, because, you know, people come out of prison and, hey, all right, here's your NARCAN, here's your test strip, see you later. You know, all right, once that's done, what do I do now? Now I need a ride to go get this stuff. Can you help me with a job? A lot of people don't know how to read to even fill out applications. So, you know, we help them with steps, you know, and it's a great job. I love it.
And I think we're all tangible evidence of something, right?
Yes.
Like, and we talk a different language than some other people. And if I've been incarcerated, Ruben's been incarcerated, they know we've been incarcerated, right? So they know we know what it's like, and we know that we haven't been back to jail, right? And we've been able to become community health workers. Like, that's huge in coming out of prison. I mean, I've been in recovery for May will be 14 years. I could take a left instead of a right at any moment, and I know that, but I also know that they look at me because they know I know what it's like, right? Like, we just have it in our language is way different than when you go to a doctor's office or like go talk to a therapist. Our language is different in our experiences. We don't have to really tell our whole experiences, they could just tell by the way we talk too.
So I guess it kind of leads to a question. I mean, how important is it for the work that you two do to have that experience so you can relate to people? It seems like that's invaluable.
We all
There's
bring
no.
we all bring different experience.
I have a lived experience as well. So
yeah,
I have
we all
18,
bring
18 years in remission from substance use disorder.
And do people ask you about this, or do you tell them, or both?
both.
Yeah, both.
Yeah.
Okay, good.
It takes the stigma away. It's relationship building and connection. We use a harm reduction approach, and it's for some it's a new language. It's a new way to say things, but we want to make sure and people have autonomy, and we want to make sure that their experience and their journey we can be fulfilled the way they choose to do things, but we want to be there to let them know that we too are there with them. Yes. We say we meet people where they're at, and we don't leave them there. Yes. Because I remember knowing someone not leaving me there, and our language and it matters how we speak about things, and we say, substance use, misuse. Yeah. We don't use abuse anymore because no one really wants to abuse themselves, but they do use substances for pain, and sometimes pain doesn't look the same to everybody. It could be physical, it could be emotional, right. And people are sometimes trying to medicate whatever pain they have.
So I guess maybe a question for both of you, because you had said 14, you had said 18 years. I guess this is a personal question, but forgive me. So what has changed from, let's say, the last 10 years? I seem to think we're much more open about a lot of things in life now, for whatever reason. But I'm wondering, from your perspective, what has changed, like in the last decade or so, in terms of stigma or different things that maybe you felt before, but maybe we've removed some of that along the way?
I come from, so I believe I'm a true harm reductionist, and I was introduced to harm reduction in the 90s during the HIV epidemic where, and I'm from Willimantic, so I was taught the same work that I'm doing, I was taught myself. So when I first came into recovery, I was kind of stuck under this traditional recovery mode that you have to do certain things to be in recovery. And in the last 10 years, I've learned and I've decided that that's not the way. That's causing more harm to people, and I'm watching more people die. So I'm able to be loud and proud about being a harm reductionist and respecting people's choices and whatever they want to do, and knowing that that we're not gonna. Drugs are here, right? People use drugs for a reason. And I just want to support people and treat people for people and love them until they're ready to do something different. And that may look different for everybody. It could be less use. It could be not using, right? So in the last 10 years of my remission, it's changed a lot.
I don't know if you had anything to add to that.
I look at it now like I love any positive change. And I can tell you, I was from New London. I had to leave New London because the stigma was so detrimental to my well-being, to me, that I went to another town to try to get the help I needed. And in that sense, I think the harm reduction was being done with me, and I was so grateful for my father, because he used to come find and look for me when I was wherever I was. If I didn't show up for 2 days, he went looking for me. And I think that's the love I got and care for my family. I should say my dad, because he was the one who was really pounding the pavement looking for me when I wasn't able to be found. And I think that's what I realized. Harm reduction was being placed in my life early on before I even went away and decided to do something different for myself. And now, as I'm walking this walk in this journey in this past 10 years, I should say, I see that harm reduction is the key to giving someone the opportunity to make a decision for themselves, for their own well-being, and it's essential for them to know what they need for themselves at the time, and we need to be there for them in that moment.
Yeah, I don't know if you had anything from your end on that. No, okay. I applaud both of you because that's outstanding, and maybe I'll ask all three of you. I mean, through your experiences to what you're doing now, I find it fascinating. Because I think you're all three making a huge difference in various ways, but also similar. And so I'm wondering, what do you feel you've accomplished in your new role, and the same thing for you as well?
Accomplished, just helping people change their mindset, just giving them hope. You know, a lot of people, the pandemic, really a lot of the drug use, a lot of it came from the pandemic. You know, let's say you was doing coke maybe once or twice a day, but then we were locked in. You know, guilt comes in. You know, let's say you was really a depressant, and you're looking now you got to really face yourself in the mirror, and you know, the use just went up. You know, a lot of us, you know, it was a lot. It was a lot. So just helping people, you know, just speaking to them. A lot of people just want to be heard. You know, I went to New Haven. I went to Dixwell Avenue to give out naloxone. Well, actually, we were feeding people this day. I have a guy in New Haven does tremendous work, almost the work that we do. His name is J. Richardson. And that whole strip was just, you know, addiction. And just going up to certain people and saying, how you doing today? Just starting a conversation instead of, you know, they're looked upon as lepers all day. You know, people, oh, let me get away from it. They're going to start asking for money. I don't got no money. You know, people just want to just be heard. They would just talk to them, have a conversation. And I learned so much stuff. You know, I met a young man, he was a doctor, and he lost his wife and his daughter in a car accident. And, you know, he came from a family with millions, and he'd been living in the woods for like 4 years. And he's like, I can go back to my parents' house anytime I want to. I don't want to. And I said, well, you know what? I hope the next time I see you, we have a different conversation. But keep fighting. Don't give up. You know, just give them hope before you walk away from them. Yeah. You know, give them your card. You know, we give them our cards and stuff. So, you know, it's just helping people. I love it. You know, I'm an ex-dealer. I'm an ex-drug dealer. You know, and I'm helping people that I hurt. I'm giving back to my community that I took so much from. Mm-hmm. So I love the work that I do. You know, and like I said, it's just the trust barrier. A lot of people don't. You can't like. Not to say that you're a bad guy, but a lot of people are not going to come, you know, that's from the streets. I'm like, hey, you know, Bryan, you know, they're not going to trust
I'm a white guy in a tie, Ruben.
Yeah.
I'm not sure I'm not the one they want to come talk to.
So they know Margaret's face. They know Trish's face. They know my name. They know Donnie. They know a lot of us. You know what I mean? So they know the people to go to. You know what I mean? And the last time I was on your show, I was talking about, you know, the pantry and feeding people. And this is how I stumbled into this job. Margaret came to my pantry, was looking for food, and I almost had to go back to work. I was like, oh man, you know, I got to go back to work. So I said, Margaret, what do you do? I want to do what you do. Because every time I see you, you're helping somebody.
So you recruited him?
Yeah.
She said, Ruben, you came to me the right time. We need somebody.
Give me your resume.
Yeah. Give me your resume. And that was Monday, and I got the interview Wednesday. And so, you know, it's just a blessing. I love it.
And for you two, you're passionate about this work.
Yeah.
And so I'm wondering what you feel you've been able to accomplish in these roles.
I think, like, you know, we don't attach ourselves to the outcome is one thing. But what we do is attach ourselves to the passion and the passion of the work, and the hope, as Ruben said, and the lives of others that we see sometimes on a daily basis. That's why I came back to New London after being away, and I started working at Alliance for Living, and it just gave me more, filled me so much because I'm back in my own community where I grew up, yes, and able to give back to where I lived and was raised in, and it fills you to a place of you know, you've, even in your mess that you thought was so messy, you've now found purpose.
Yeah.
And if that's the fulfillment of this. It's like I can't keep it if I don't give it away. You know, type of, and that's a cliche. Yeah. No, but even in this work, and even what we're doing, I can't hang on to this because it's too good. This, right, what we can see that can come out of this, the work we're doing. The lives are good. They're good people. They're human beings that deserve opportunity, just like someone saw it in me. Saw that for me. So I think that's it's a day. Every day we wake up and it's like, okay, and we don't know what's going to hit us, but we just know we have to continue to press on.
Yeah, I guess the same question for you, Trish. I saw you smiling when she was.
Because it's the truth, but it's our lifestyle. This is my lifestyle.
Yeah.
It's our lifestyle. This doesn't. I don't clock out. I have a 13-year-old daughter who can do a NARCAN training for you, who looks at people and wants to pray for everybody and treats people with respect. And so if I'm raising a kid and my kid is coming out like that, I've made some really bad choices in my life, and now I know like what I'm doing now is good,
Making
and
a difference.
it's making a difference, and it's making a difference in my life, my kid's life, and this isn't just a 9 to 5. This is our lifestyle.
You said it, I think, best, Ruben, that people want to listen. They need someone to listen to. They need an ear. And that was a few years ago. I helped a girl. I got a call. This was before I was on the board of ed. I got a call that her parents were away. She had no food. And so they asked if I could come, a teacher asked if I could come and grab her and take her to food pantry. And I did, and they took her around, and they got her everything she needed. And we got everything in the car, and she was sitting in the passenger side, and she's just bawling her eyes out. And I'm like, okay, I'm gonna wait a second. Let her bawl her eyes out, and then I got in the car, and I just said, are you okay? And she just looked at me, and she said, I didn't know anybody cared. And I cried then. I'm like, but I think our community, and I'm sure others, people sometimes don't know that there are people there who do care and will be on call 24/7, which is crazy, by the way.
Yeah, I mean, it's not 24/7, but we will get back to you within 24 hours.
Right,
But yeah.
But it's not a clock out job.
No,
I
this
mean,
is a
I
lifestyle.
don't think you can schedule an overdose.
No.
And I'm sure someone who's done drugs, they do this day, this day, this day, pick which one you might overdose on, because
And nobody wants to die.
No.
I wouldn't imagine anybody does. So what we've got a few more minutes here, and 2023 is going to continue along, and I'm wondering what you foresee moving forward, or are we going to see more of an uptick, or are we going to come back a little bit? Where are we headed?
Well, there's some new trends out there, so we might see some changes in the type of drug and substances that are out on the streets or are being used. We have to. So we always try to get ahead of the game. And I say it's not a game, but we try to get ahead of everything. But we always like not one step behind, but we're geared up and ready for what's happening now.
Yeah.
Whatever's coming next, we're here as bodies to be ready to attack whatever's going to be out there in the streets or what's being taken or whatever's going to be coming out down the road. We're ready for that. We'll get up to learn and get more knowledge and understanding from the experts that are from different doctors. That we have a great group of Yale School of Medicine doctors that give us insight and training, and we get the National Harm Reduction Coalition that also we get trainings from them to how to approach the things that are new and coming our way. Things that we don't foresee, but what does happen is we're prepared to learn and get more knowledge and be able to serve those in the community.
Okay, and then maybe for you, Ledgely, what you're doing, anything new and exciting coming up?
We're just trying to get more trainings. I'm trying to get as much training and more knowledge. Like I said, now we're dealing with xylazine. That's a whole other conversation.
Yeah, so
Yeah, but we only have 2 minutes.
Yeah, no, that's what I'm just saying.
Yeah.
Bring it up.
I'm just saying,
We're already gonna
2023.
we're not
This
gonna
is
bring
what
it
we're
up.
dealing.
Yeah.
This is what we're dealing with now.
Yeah.
The horse tranquilizer and the fentanyl mixed together. It's another conversation. It's a whole other fight.
Yeah.
We'll have to do another show with all.
Oh yeah.
and on a word I can't pronounce.
Yeah.
So we have our stuff up here. Can one of you mention the phone? You said there's a phone number they can call you. Maybe we could just mention that on air. Maybe Drew can
Yep,
put
the
it
number
on the
is
screen.
860-333-3494. And
Okay.
it's right on. It's on there as well.
Oh, on the bottom over here.
Yeah,
Okay.
we're on Facebook. We're on Instagram. New London County Cares. So
So on Facebook, is it NLC Cares or is it?
yeah.
Okay, so they can find you on there. And
Yep.
do you answer messages on there as well, or?
Yeah, you can text that phone, you can call, you could be anonymous, you don't have to give whatever, but we will text or call back, whatever you're comfortable with.
Okay, great. I'm not sure I have any more questions here. Was there anything else you guys wanted to add from
thank
our
you.
kind of our roundtable discussion on everything?
No, that's I think.
Okay. Well, I really appreciate you all coming in.
Thank you.
I don't,
for having us.
don't enjoy the subject, but I think it's a necessary thing, especially in our community. And I appreciate Trish, Margaret, and Ruben. Thank you
Thank
so
you.
much.
Thank you. Thank you.